Welcome to URL, Unzip, Reboot and Leave, a podcast about the psychology of everything. Through real conversations with thinkers, doers and seekers, we explore how humans adapt, evolve and thrive across migration, entrepreneurship, healing, culture and the search of meaning. So let's unzip, reboot and leave. Today our guest is Rima Syamal, who is a professional homeopathic practitioner with over 20 years of clinical experience. She is a member of the Australian Homoeopathic Association, registered with the Australian Register of Homoeopaths. Today we will talk about psychology around homeopathy, its scientific research, scope, and the philosophy of these age-old remedies. So what is homeopathy?
So homeopathy is a natural therapy which helps in maintaining good health and well-being, as well as aids in the recovery process towards good health from ill health, with the help of the body's innate powers and mechanisms in self-regulation and healing. And it is an age-old therapy. It has been around for thousands of years, but it has only been formalized by Dr. Samuel Hahnemann, who is the founder of homeopathy for over 200 years now. The WHO has recognized homeopathy to be the second most used medicine in the world. What psychological needs or belief basically lead people to explore homeopathy? So just before I start with that and answer that question, I'd also like to add that homeopathy is based on a law of similia similibus curanta, which means likes cures likes, whereby a substance that has the potential to cause disease in a healthy human being has also the potential to heal those symptoms in a sick individual. For example, if we use something like coffee. So coffee, for instance, is used, as we know, by a lot of people, but when homeopathically used, so coffee basically brings about insomnia on a healthy human being. But when proved homeopathically and when used in minuscule doses, very minute doses, that is, they become homeopathic remedies, and coffee, when used homeopathically, brings about sleep in a sick individual. And that is what I mean by likes cures likes. And that is the meaning of similia. And this is a very principal element in our homeopathic help and support that we give our individuals and our clients. And that is how homeopathy really works on that basis. Now, why people are psychologically steered or drawn towards homeopathy is because homeopathy is natural. It is gentle, it is very calm, it helps patients to calm down, it helps infants, and it can be given through all age groups, like starting from infants right up to elderly. So it covers a massive span of age groups because it's natural, and they know that there's very few side effects caused by homeopathy. Like in India especially, because this is a natural thing and people have this kind of awareness that there is very less or no side effect, number one. And number two is it's cheaper in India, right? Absolutely. So those two predominantly people drawn into it. Yep. But when you come to this like developed world, yep, Western world, apart from these side effects, is there anything else? Or just people who are drawn into organic stuff, they're also drawn into these natural remedies, and that's why people are coming in? Yeah, I mean mainly because, look, they don't want adverse effects from conventional therapies. So and not that we need conventional therapies. Homeopathy only supports conventional therapies in the Western world. And we are CAM practitioners. Basically, we are just complementary and alternative care practitioners. So we are not mainstream. That's in Australia? In Australia. Okay. In India, however, that's not the case. Right. In India, we are mainstream homeopaths. I mean, I've done my bachelor's in homeopathic medicine and surgery. I'm basically essentially called a doctor there.
Right.
But in Australia, the rules are different, and we follow the Australian guidelines where we only help to look after our patients or look after our clients in a very natural way with the help of our remedies.
So is it like same in UK, US, or?
In some nations in the world, for example in Germany, in Paris, homeopathy is considered to be mainstream, and even GPs can use homeopathy as conventional, along with their conventional treatment. They do you make use of homeopathy as well, and especially in chronic conditions, right? So it is quite widely used in many countries of the world, including India. But then again, yes, I wouldn't know about other countries, but talking about Australia, definitely we are not mainstream, and we can just help our clients alongside conventional. But then coming back to your question, and as why psychologically people are drawn towards homeopathy even in Australia, is, as you correctly said, it's natural, and as you said, you mentioned about because they take other natural therapies as well, and that includes homeopathy.
There is an automatic attraction towards organic stuff and natural stuff.
Absolutely, and homeopathy being one of those things. And because it's gentle, it has no side effects, as I said before, and infants can take it, and mums feel very relieved when they give their children homeopathy because it's natural, and they feel that there is no again, there's no adverse effects from it, and they get well as well. So they feel a bit satisfied after having that, and even in elderly. So the way it works really is that they go to conventional therapists, medical, the mainstream, they use their remedies, they have to do what they are told, for example going to a physiotherapist, doing all the works, and after that coming to homeopaths. And what homeopaths can help in little infants, for instance, they're going to kinder or they're going to school and they have a little bit of a runny nose, so they don't want to go into the antibiotic stage. For that they come to homeopaths so that they can naturally be helped.
Where normally we get medicine, homeopathic medicine in Australia?
They're from various pharmacies. A lot of local pharmacies, they're huge pharmacies in Australia, like you have Brawa, you have Martin and Pleasance. I take my remedies from Martin and Pleasance. The way in which our remedies are made, just from curiosity point of view, is that we take it from all natural resources, first of all, to begin with. So they can be plants, animals, minerals. We use these as our principal resources, and then we put it in a mortar and pestle, and they're called triturations. There's something called trituration and there's something called succussions, where we're using liquids, that is, and we are kind of grinding it to the point that we are building the energy from this. So we're not really mixing portions. We are just using one active principle, and we all know copper sulfate as a mineral kingdom. And we use a thin material of copper, and we use it in a mortar and pestle, so just a thin sheet. So we are basically not using a lot of resources. We are not consuming the world's resources. We are just using a very thin sheet, naturally done, and we put it in a mortar and pestle, and we grind it to the point 100 times over to sort of bring up the energy. That's the active principle, and that's the original substance. And then we dilute it further, and we make further and further. So we make it from 1 centesimal scale to 2 centesimal scale. That's how we do our measurements, and then move into higher potencies, which is a 3 centesimal scale. So, and that's the basic portion is called a mother tincture, and then we keep diluting in and diluting it till the energy, so it goes up to 30, 200. So we are raising the value of the active principle, at the same time we are diluting it at the same time. So,
and this dilution is happening with water, or
you can you sometimes use water, or we can also use lactose, which is sugar of milk. So that can be, so that is a trituration, and dilutions are done sometimes with water or sometimes with alcohol as well, and that's how to bring up. So alcohol basically acts as a preservative, so there's a very little amount of alcohol used. The basic principle is that active original herbal medicine that we are using, or the mineral source.
Nice, very nicely said. where can we find the research in homeopathy?
Yes, there is a lot of evidence that homeopathy works, which has been confirmed by hundreds of clinical trials, and homeopathy forms a part of the mainstream medicine, as I mentioned before, in some countries around the world. So, Biomed Central Complementary Medicine and Therapies is one of those journals that publishes the original peer-reviewed research articles. Also, the Homeopathic Research Institute in UK is dedicated to promoting high quality research in homeopathy at an international level. The largest ever national health service in UK for homeopathic study, carried out in Bristol, spans 6 years of research with 6,500 individual patients on chronic diseases such as eczema, migraine, arthritis, chronic fatigue, irritable bowel syndrome. All were successfully treated. In children, around 16% of asthma patients and 82% of eczema patients showed clinical improvement. So 74% of migraine cases sufferers, 72% of chronic fatigue syndrome patients, and 77% of women suffering from menopausal problems reportedly showed improvements. So thereby showing evidence that homeopathy works, and there's always work that is being carried out as we speak. There's a lot of research happening in the background. Even in 2011, you would find that the Swiss government published a report supporting complementary medicine, and homeopathy being one of them, in particular, for its effectiveness as a complementary and alternative medicine therapy. And a lot of our practitioners there have even done their MDs in homeopathy, so they're masters. I'm doing an advanced course in homeopathy currently because, like I said, our associations always encourage us to study. We have to do our continuing professional education, and currently my advanced course has been that of Dr. Parimal Banerjee's methodologies.
So is there any limitations, and what are the limitation and scope?
When we talk about limitations in homeopathy, although it's very natural, because the way in which we give our remedies, like dispense them for instance, and the instructions that we give our patients, the instructions can get a little bit difficult to follow at times, and that makes it, for example, if I'm dispensing out a remedy and I'm going to tell my client, please take it every other day, or please take it every alternate day, or take it every 7 days, they become a bit hesitant as to how are we supposed to take that. So that can become a bit confusing. So we have to be very well, we should be able to educate them, because being disciplined is very important when you're doing homeopathy. So that is necessary. And then we always say 10 minutes before and after, you cannot have food. Water is fine, but do not take food. Or if you're having something strong like coffee, we should avoid that 10 minutes before and after, before taking our remedies, because naturally they're very gentle, they're very minute, and we ingest them, so we take them orally, and they can the properties can be interfered because of the interference with the food or with the taste of coffee. Well, and especially for little children, they don't have a perfect time so that becomes a sort of a limitation, but that can always be overcome by good education and proper explanation. Other than that, I think the way it works is that because it's very slow, it is slow because it's very gentle, and there's only so much remedy we can give to just build up the stimulate, or it acts as a catalyst to sort of stimulate the body's own powers.
Sometimes in India I heard this, in homeopathy medicine, whatever the symptom you have, it's kind of going up.
Yes.
It's getting exaggerated.
Yes.
And then it's actually trying to calm it down. And
absolutely.
This is how it works, right?
Absolutely, and that's a lot of homeopaths want that. So what we actually call as a homeopathic aggravation. So that just goes to show that the remedy is working. Just to show that we've given the remedy that is most suited to that individual. And that is how our remedies work. And we really want that homeopathic aggravation, not in the point that it's gone overboard, but just enough to stimulate the person's own response, body's own response, to bring about good health and well-being. And that's what's required, basically. So having a homeopathic aggravation is not a side effect. It is what is required.
Is homeopathy only for chronic conditions, or does it help in acute or preventative care too?
Homeopathy acts well in acute and chronic conditions, both. So in acute conditions, I can mention a few diseases that it can help in. For example, headaches or upper respiratory system infections, colds, coughs. These are the acute conditions homeopathy can work with. In chronic cases, it can help again in respiratory symptoms. Also, it can work in eczemas, skin conditions. Homeopathy does well with skin conditions, as well as migraines or chronic fatigue, in irritable bowel syndromes. So it's got a vast area that we cover, where it covers in chronic. Even in post-op conditions, homeopathy is very good in healing of wounds. Like the person's had a surgery, for example, ankle or knee operation, and homeopathy can heal in strengthening the ligaments after a surgery.
Sometimes this question comes under like, can we use allopathy and homeopathy together?
Absolutely can be used. And the thing is, with homeopathy, we cannot talk about, as you mentioned previously to me and asked me that question, as a preventive. We only look after our clients as they come and present them with their set of symptoms. So we cannot call something as preventive. However, when the client comes and presents the set of symptoms and continues on with our remedies, we can help to sort of annihilate or remove those set of symptoms, hoping that those symptoms don't return in the future. And that is the process that we follow homeopathically.
What involves in homeopathic consultation and what type of medicines are given?
Yes, homeopathic consultations involve a very detailed investigation of the client when they come to us. They could be acute or they could be chronic cases. In acute, it doesn't take too long, about 15 to 20 minutes. With chronic, it takes longer, 1 hour of consultation. So when I say a very detailed investigation, I mean we consider the family history, we consider the past illnesses of the client, and we obviously consider the chief symptoms. So headache can be acute, and it can also be a chronic headache, maybe due to sinusitis, and that's what. And assuming that the client has gone to conventional, to our GPs, has checked it out, and everything's good, comes to us saying, "Oh, I've still got this nagging kind of a headache, or that just doesn't seem to go. What can you do for me?" And that's when we start our detailed investigation. So we will ask, what kind of headache is this? Since how long was this? Where does the pain radiate? How do you feel when you get the headache? What is are you irritable? Are you tensed? Are you anxious? And is that why you've got this lingering headache? So we go into a lot of details. The modalities of the case is very important. Like we say, when does this aggravate? When you're sleeping or when you're awake? When you're focusing, when you're concentrating, and then we also ask the sleep patterns. We'll ask the likes and dislikes in terms of food, aversions, what aggravates. Sometimes they will say that, I'm allergic to so and so I can't tolerate this. So we have to keep a full case study of the client. It's very important, and that is why we have this huge questionnaire that we keep going on and on about. And the simple reason is because when we prove our remedies on healthy human beings, all this is documented in detail for that remedy, and therefore we have to find an exact fit of that remedy to the symptoms of the client who's presenting to us. And we believe that no two individuals in homeopathy are alike. They're each different and they get different remedies. Each individual gets a different set of remedies to what another person gets. So for example, you present to me with a certain set of complaints. Your complaints are different to another person's, obviously, but your makeup as well, your constitution, your physical makeup, your likes and dislikes are what homeopaths take into consideration before we give a remedy. So we find a best fit remedy for you. It's like the hand has to fit into the glove. Even with colds, one infant may not present the similar cold like another. So one infant may be just very placid, and therefore we will give a different remedy. Another infant is very irritable, clinging to the mum. That's why we give that infant a different set of remedies. Although the common symptom is that of a cold, but they're both different individuals, and that is why they have their own traits, and that's why homeopathy is so individualized. There will be sepia, or there will be calcarea carb, and I also did mention cuprum, which is copper sulfate. So that is cuprum in homeopathy. So these are the different remedies that are the names of various remedies that we consider.
But like in what portions, and
Yes.
that is basically your wisdom.
That
and
is what every
your training
homeopath
comes
is
into the
trained
play.
in.
Okay.
Yes. So you would have a 30C, like a 30 centesimal potency, or we might have 1,000, that is 1M. So it depends on the susceptibility. It depends on what symptoms the client presents to us, and we decide on the dose.
Right.
But also that they are prepared according to guidelines, on the basis of international guidelines and pharmacopoeias. So they are TGA monitored in Australia.
Okay. One little lighter question.
Yeah.
Why those sugar balls still given?
That's the
behind it?
essence of homeopathy.
Okay.
That's the reason why infants and children love it,
Oh,
because
yeah.
they are so sweet.
Yeah.
They don't want to take those bitter liquids in their mouth,
Right.
and that is the simple reason why we are dispensing it in sugar balls. And also they tend to absorb liquids better as well. So what we do is we add our liquid to the sugar.
Balls or powders?
Yes, to the
Yeah.
pilules, as we call it.
Pilules,
And we add our liquids to that. It is the way it has been dispensed, but like I said, it can be with the help of globules, or it can also be liquids. You can also use liquids, and a lot of clients use liquids too.
You have done a course in Monash, which is on food as medicine, okay, from Monash University. How do nutrition and lifestyle interplay with homeopathy?
So as we all know, homeopathy is holistic. Homeopathy never works independently. It works with the help of fresh air, homeopathic remedies, good diet, nutrition, and exercise, yoga and meditation. These are the keys to good homeopathic use of how homeopathy actually works and helps individuals to really get well. And someone is being treated in asthma, for example. If a child is being treated with steroids, puffers, inhalers, we as homeopaths cannot stop that. We have to let them do what they have to do, because that's best practice. Conventional treatment is the best for them, and GPs are what is the ultimate in Australia. However, when the client comes to us with that little child who has been taking inhalers, puffers, and steroids, and they say, oh, he's taking this, but however, we like to take something natural over and above that, we are most happy to help homeopathically. And we can give our remedies that can only help the little child to sleep better, because he's got the asthma attack at night, over and above his puffers and inhalers and whatever has been given by conventional. Now, similarly, in that case, the next question is by the parent, how are we supposed to, what diet do we give our little child? What can he eat and what he can't eat? Because every time he eats something, he throws up because he's got the bouts of coughing or he's got the asthma attack. So avoid processed food, first of all. That everyone knows, that's common sense. Reduce sugars, and this is what Monash will say too. So when I'm talking about food as medicine from Monash, it's more, and it doesn't, so they cover FODMAP diets, which are used very commonly in IBS, which is where they tell us what can be taken for bloating and conditions such as bloating, and in various conditions they say take your fruits and vegetables, which everyone knows, take your carbohydrates in good amount, take, we know these things, variety, colored fruits are essential. But over and above that, when they visit us, again, in cases of acne, if I get an adolescent who's eating processed foods and who's having his carbonated drinks and sugary drinks, acne is not going to get well. He's not going to get well with his acne. It's not going to recover. Over and above that, he comes with for homeopathy. My first thing to him will be, please stop all your processed foods and all, if you can. Please restrict yourself, because then homeopathy will find a firm ground to work for you in that condition. Because if you're constantly going to take what you're going to eat and then you're expecting natural therapy to work, that's pushing it too far. So therefore, and that becomes an impediment for homeopaths, that becomes an obstacle to help the person to get better and his acne to subside. And therefore we will say, please don't take sugars, and then my therapy will work for you if you can prevent taking these. So these obstacles, once they're out of the way and good diet is taken, for example, if you're taking good fruits, vegetables, we all know, and healthy, drink lots of water, will help you in your skin condition. So this is how it helps us as homeopaths as well. And then we say it's holistic, because he's taken care of his diet, his food, his nourishment, and then homeopathy has got a perfect ground to work in such a condition.
Great. How many liters of water we should take?
I believe it will be 8 glasses a day.
Okay.
That's what they say.
In this typical Melbourne cold weather?
8 glasses should be good.
8 glasses,
Yes.
which is what,
Because
roughly 2 liters?
I would say 1.5 to 2
1.5
would be
liter,
great.
okay.
But the point is, because even if it's cold weather, it should be taken, because there's a lot of dryness that you get in cold weather. So yeah, it's better to have lots of water.
Okay. I just like to mention, because in these days there are a lot of loneliness, anxiety, these kind of problems are happening. Can people look into homeopathy for it?
Absolutely. You can look into, we can look into it as a natural therapy.
Right.
And we can help, as I say always, we can support over and above if they're on conventional medicines. That's what they should be taking if they have any anxiety or anything. But yes, homeopathy can definitely help with anxiety. There are phobias, like for example, there's stress. They all come and say, oh, we are stressed. So you have to understand where the stress is and how physically is it affecting the individual. And again, we do a holistic case taking from mentals to physicals, and we help in supporting those conditions. For example, grief from loss of a loved one. Homeopathy can very well support that with remedies. Over and above, if they've gone to the point where they just can't control themselves, yes, a homeopath would definitely ask them to see their GP, who can forward them to their psychologist or someone. But definitely there are remedies to help that condition. Also, emotional imbalances can also be dealt with
Like,
homeopathy.
I guess ADHD and all these kind of stuff also.
Well, we don't consider, like I said, we do not consider the diagnosis in
Yes,
homeopathy.
I understand.
So
but
they
we
will
can
come with the
definitely-
symptoms,
Yeah.
you know, where you have a very hyperactive child. Homeopathy can help in calming that child. For example, also in conditions like phobias, like I say, like anxiety before an examination, you know, and going on stage and speaking, that's another anxiety. So these kind of conditions, homeopathy can deal with, we deal with, and we help giving remedies in such conditions.
I used to have that, like before exam, I had to go to toilet many times.
Yes,
I don't know how, but now I don't have that.
yes.
I don't know where it stopped, but
Yes.
oh, it was a problem at one point of time in my life.
And that's when we do have remedies for that kind of a situation, where you've got to rush to the toilet and get diarrhea because of that. So there are wonderful remedies for that.
Where does homeopathy stand in today's scientific ecosystem?
Yes, that's a very good question, Gautam, because in today's 21st century, I think homeopathy is a 21st century medicine, for the simple reason that it's a very environmental friendly medicine to use. It is an ecologically sustainable medicine because it's non-toxic and it's non-polluting. Non-toxic for the simple reason that there's no waste involved when producing these remedies. They can be reused always. We are not foraging natural resources. In fact, we are making use of them in a way that we are producing remedies out of them, and very little amount is required. So we're basically really not using up the environmental resources, and it's renewable, it's cost effective, and that is why we are giving to the environment what we are receiving. So in no way are we creating any toxic waste, if at all very little. Even like as I explained to you earlier, how our remedies are prepared from the very little original substance, which is the active principle, is used in making these remedies, and therefore I think it is a very ecologically sustainable medicine to use in today's world.
Wow, nice. You, like a trained practitioner from India, so Eastern wisdom.
Yes.
You also trained in Western
Yes.
philosophies and
Yes.
academics, and you are, because living in Melbourne, you are also approaching with these two sides of wisdom to your patients. You actually wrote a book with your dad, and the book name is Pocket Book on Homeopathy Philosophy and Repertory.
Yes.
Please shed some light on that.
Yes. It was actually published way back in 1998
Okay.
by my father, who is Dr. Satyaranjan Das, Dr. S.R. Das, who practiced in Mumbai as a homeopath for about 50 years. I'm the third generation homeopath, and it is also a tribute by my father to my grandfather, Dr. A.C. Das, who was a pioneer in homeopathy in Mumbai, and he too practiced over 50 years. So we've got a long history out there of homeopathy. You could say it runs in our blood, all of us, and they've dedicated their lives to homeopathy. So, and the first part of the book, which is a synopsis of homeopathic philosophy. So when we talk about philosophy in homeopathy, we talk about the laws and the ways in which homeopathy works, really, and that is basically very difficult for laymen to understand. It's more for homeopaths who've studied in the art of homeopathy. My grandfather way back has tried to bring about, and this is exactly how he practiced and has cured lots of people and lots of patients. He's been famous, and he's even the Gwalior, Maharani of Gwalior used to come to him. He's even looked at Mahatma Gandhi, Subhash Chandra Bose, all of them were his patients. So he was very well known. And then my father took up his clinic after that. My father basically was a doctor, a medical doctor, an MBBS, studied from Kolkata Medical College, and then took over my grandfather's practice. And he himself has dedicated, he was brilliant in his diagnosis, being from the medical world, and he was a perfect example of how you can amalgamate homeopathy and medicine, conventional medicine together. And so he was very successful in his times in treating very many cases. So the repertory part, so the initial part of the book comprises of the synopsis by my grandfather. The repertory part was compiled by my father, who has looked at about 50 to 100 patients in whatever the number of symptoms that he's covered and helped treat. And those remedies have worked in those symptoms and cured those diseases. I can say cured for India because he genuinely did. And very many cases I've sat with him, worked with him, and I've helped him compile the book and the repertory. So absolutely, so that's why a lot of memories there.
Thank you, Rima. Thank you for your time.